Bob. My name is Destiny. I'm going to be your nurse today, and I am just going to be placing an NG that your doctor has ordered. Have you had one of these before? He tells me, yeah, he had to have one a couple years ago, so he's pretty familiar. Knows that they're uncomfortable, but they don't really hurt. Can you please state your name and date of birth? And he tells me Bob and his birthday, and it matches my chart. Do you have any allergies that you're aware of? He tells me, nope, no allergies. So that's good. I don't have to worry about him having a reaction to any of this. And I'm just going to turn this suction on low intermittent. So that's what I'll be hooking up your tube to after it is connected. And I just check to make sure it's working. And it is. Alrighty, so now I need to make sure he is in high Fowler's position. And I'm just going to check your nares to see if there's anything that might be blocking. I do not see anything. So now I'm just going to have you breathe out your right nostril and your left. What one feels like you can breathe better? He tells me his left, so that's the one I'm going to be doing. I don't see anything in his mouth, anything back there that should be causing any problems. I'm just going to put on one glove. And I'm just going to be testing your gag reflex here. Alright, and he gags, so all is good. Do you have any trouble swallowing water, anything like that? He tells me no, so I'll be able to give him this cup of water, which will help aid the tube down. Alright, so now I'm just going to put on this pad. And this is just to catch anything that may come out, so then it doesn't get all over your gown. Alright, so I'm going to wash my hands. And then I'm going to just measure. And you measure from the ear to the nose, and then down to the xiphoid process. That is where you mark. And if the numbers are very legible and you're going to remember, then or write it down, you can use those. Otherwise, a nice piece of tape will also help for you to know where to stop. Alright, so now I'm just going to apply some skin prep. And then, so it has enough time to dry as I'm placing the NG. My hands again. Alrighty. So like I said, he would be in a high Fowler's position. Bob, once I get the tube all lubed up and ready to go in the nose, you're just going to have to hyperextend your neck for me. And then once you cough, I'll have you then tilt your head forward, and we will advance the rest of the way. Alrighty, so extend your head, neck backwards for me. I'm just going to insert, making sure to angle down. Alright, and he coughs, so he's going to lean his head forward and tuck his chin. I'm going to keep inserting, and do not see it in the mouth, so that is good. Alright, and now, once I got to my tape, I need to make sure to tape my tube in place, and I'm just having that sit upright so nothing spills and comes out. Alrighty. Place this up here. This tape can get a little annoying, I know, but it's got to hold it in place for you. Wrap it up. And this one around. How's that feeling? Tells me good. Are you having any troubles breathing? He tells me no, he's doing okay. Alrighty, I'm going to make sure this is open then. I'm going to connect it to the suction. Now to verify the placement, I want to obtain a chest x-ray, which is usually most facilities. And then once I get the confirmed chest x-ray, if you were having any tube feedings, then I would be able to go ahead and start those, but you need to wait until you get the confirmed chest x-ray. And then I could also check the pH, and that can determine where his NG is, if it's actually in the stomach in the right place. For younger children or smaller children, they obviously are not going to need as long as a NG as someone who is older and bigger and has a longer pathway down to the stomach. Bob, do you have any questions for me? And he tells me no, so I can dispose of my supplies. Now that this is all hooked up, I don't have to worry about it leaking on him. I would want to document the time, the date that the NG was placed, the size of the tubing, maybe what kind of tubing, what the suction is set at, how he tolerated the procedure. So like I said, I did check for the gag reflex. He didn't have any problem swallowing. I would also want to monitor and assess for signs of any respiratory distress or any, and even if there's some aspirate in the tube, assess the color, because like I said, that can determine where the tube is if you didn't already have the confirmed placement. And yes.